Well, has Alberta taken the right measures to curb the COVID wave, and do these measures come too late? Let's bring in Dr. Jenne. He is an associate professor of microbiology, immunology, and infectious diseases at the University of Calgary. Dr. Jenne, thanks for your time today. It's good of you to take time to speak with me. Thanks.
Hi.
Look, Alberta has a big challenge. We all know that in trying to get control of this COVID surge. Has the Premier taken the right action to make that happen?
I think, unfortunately, the Premier really didn't have much choice at this point. We have seen on record numbers the last few days, both in new cases, but as well as active cases in the province. And we've seen record numbers of ICU admissions. So really, we're faced with few options. We have to get this viral spread under control, and we have to do it quickly. And as a result, we've had to come in with very broad, very restrictive measures.
Do you think these latest restrictions go far enough?
It's difficult to say. We've had restrictions in place for a while now that have not been effective, but a lot of that does appear to be compliance. And whether that is the large public displays of defiance or everyday failure to follow some of these guidelines. And we see that, for example, on patios where people are not restricted to single cohorts for in-person dining on patios. So it really is going to be a combination of, do these restrictions go far enough? Hard to say. Will people follow them close enough to have that impact? And that really, I think, is the question that has to be answered in the next week or so.
The Premier talked a lot about that today, about some of the challenges that seem to be of a particular nature for the province of Alberta. And one of those was the whole idea of following the rules, essentially. And the fines for for ignoring the health orders, they're being doubled. But I guess how big of a problem is the enforcement side? There's been lots of criticism that people know and can find people breaching the rules, but the enforcement's been lax.
Yeah, it's a great question. I mean, I don't unfortunately have any information on what the mechanics are behind that, but we do see routinely large events that are breaking the public health guidance, and then we hear following that few or no fines were imposed. So it has become a problem. I think it's something that really has grown over the last year, and I think this has been something in the province that we've not been very good at enforcing from the beginning. And as a result, it's really snowballed as the pandemic has progressed, and it is now a big driver behind our failure to get these numbers under control.
Is there one of these new measures that's now been introduced by the Premier and by the Cabinet that you think will really make a difference? And because he described that today, and you're clearly well aware of it, there's a real urgency to try and get these numbers down quickly because of the strain on the hospital and healthcare system. So is there one thing in particular that the province is now doing that may precipitate a drop here?
No, I don't think it is one thing in particular. I think, unfortunately, the data is clear that the virus is spreading in most aspects of society, whether that be work, school, or social events. So we've really had to come at this with a broad approach. And the hope is by targeting all of these sectors that we can, as a collective, get those virus numbers down. The one piece that is interesting, and again, we'll see what the impact is, are the enhanced fines, are the enhanced coordination between the various law enforcement agencies in the province, and the hope is that we can get better compliance so that we get a more rapid effect of these restrictions.
Let me talk a little bit about the other big development today that is going to help a lot of provinces, and that's the decision by Health Canada today to allow the use of the Pfizer vaccine, or to okay the use of the Pfizer vaccine for anyone 12 years of age and older. The Premier then quickly announced today in Alberta that it'll be open. Vaccinations will be open starting Monday to anybody 12 and older. How big of a difference can that make to a province facing the problems that Alberta is?
Yeah, this will be an important step. We have to remember, though, as a society, we need those vaccine numbers to be up. And when we were talking about vaccinating only people 18 and up, that threshold became really high, probably not achievable, given that about 20% of the population of Alberta is under 18. By opening this age group up, we now know that the vaccine is safe, that those clinical trials have been completed, data filed with Health Canada and reviewed. So we have confidence in the vaccine. We know it works in this age group. That this will allow us to get more people in the province vaccinated and get that overall population number up and closer to what we would term a herd immunity, where we can have some community level protection. Prior to this, knowing that 20% of the province was under 18, it would have been essentially impossible to hit a true herd immunity in Alberta.
So let me finish on this. Do you believe that these new restrictions, the expanding of the vaccine rollout, will that be enough to prevent the province from hitting this red zone that Jason Kenney talked about today, which is the utterly stretching of the hospital system that he says could happen in early June if we don't get the numbers under control? You don't get the numbers under control in Alberta. Is this going to do it, do you think?
Again, I wish I could predict the future. On paper, these are, productive measures. These will have an impact on paper. The difference is translating paper words, announcements to real life compliance and enforcement. So I think that that's the key here in Alberta, that we have seen announcements. We have seen, fairly restrictive decisions made about 3 weeks ago, and they've had no effect. And the reason is we're not following them close enough.
All right, so the next, week or 10 days or so will tell us what's working and whether it's working in Alberta. Craig, Jenne, always good to talk to you. Thanks for your time today.
You're welcome. Take care.